Welcome back to Whitecoat Medicine Talks. This is Dr. David Cruz. Today we are going to be talking once again about dementia and focus on nutrition. We know that many people with dementia can suffer malnutrition and get dehydrated as well. And it becomes very dangerous for them because at this point they cannot really take care of themselves very well, and getting in these conditions may worsen their symptoms and lead to an untimely death. It is important that they eat well and that they're comfortable eating, and it's going to take some work sometimes. As their dementia gets worse, then your job as a caregiver is going to become more difficult. But we can go through it today, and we can see that there might be some options and some ways that you can kind of take care of these issues. First of all, a healthy diet is the most important thing. Try to lay off the sweets and the junk food and try to get more healthy with the choices that you all make. So if the patient were used to eating a lot of junk food, it will be a hard kind of transition. However, this needs to be done to kind of help the patient's mind, memory, and functioning. For some people that have now resumed the role of a caregiver, it might be the first time that you're going to be cooking. Maybe it's a spouse, maybe it's a child, and maybe you're not used to doing that. And so if you don't know how to cook, then that may become a little bit of a problem. However, we need to find ways to circumvent that. Some people can afford to hire people to come in and cook foods that the patient may like. However, many can't. And so that's where you have to start making some decisions. First of all, I think I would talk to your doctor to see if they can refer you to a nutritionist or a dietitian. There you can kind of start discussing what is the best foods to give. You can just start discussing with them what the patient likes, what they don't like, and then try to find different meal plans that might fit and might be easy to make that the patient or your loved one will like. Sometimes it's hard enough to cook one meal, or to make 2 or 3 meals might be more difficult. And so that's when you have other choices as well. You might have something like Meals on Wheels that the patient may qualify for. And if that's the case, then definitely try to look into those services. There might be senior centers that may be beneficial that will feed the patient as well, sometimes nutritiously. And you can look into your local churches as well and see if they would provide any type of benefit as far as meals as well. I think another option would be try to look at some of the restaurants in town and figure out what are the healthy meals from those restaurants. And maybe sometimes during the week, once a month, twice a month, maybe 3 times a month, it depends how much you can afford, is get those meals brought over to the house for you as well. Now, when it comes down to meal time, what do you want to do with the patient? It's very important to have them be sitting down. Of course, patients with dementia are very easily distracted, and they can choke or they could forget how to chew as well. And so we have to be very careful with the choices of meals that we give them. So make sure that they're sitting comfortably, and make sure that you kind of eliminate distractions as much as possible. They can get very distracted with simple little things, salt shakers, ketchup, any condiments that are on the table. Maybe even the pattern on the plate might distract them. So you want to minimize distractions so that they focus directly on the food, because if they're forgetting how to eat and what to do at the table, less distractions are going to be better for the patient. So at times they might like company, and then some patients and some people eat better without company. So you might have to leave them alone so that they can focus more on their food. Anything to minimize distractions. Now, if they do better with somebody there present at the table, perfectly be there with them, and that may help them along. Make sure that the place is well lit as well. Make sure that you let them feed themselves as long as they can. As long as they can feed themselves, let them work on those things. Now, there can be utensils that are a little bit bigger that they might use. Something that is more spill-proof would be great. When you choose plates, like we said, limit the patterns on them, make them more plain. And also maybe if they eat with a fork or a spoon, make sure that they have some sides on those plates, because that way they can push the food along the side and pick it up easier. They'll feel better about themselves if they are feeding themselves and doing things on their own. as long as the patient is eating well, there's no problem. Now, as the dementia goes on, you might notice that you have to cut the food more for them. You may have to puree the food. They might be able to only eat soft food, depending if they're not swallowing food at all very good. So look out for those things and make sure that the food is cut appropriately or prepared appropriately for each individual. It is probably ideal to have plates that may have either suction cups or they don't slip very much, because that may be problematic for the patient. Also, you want to not fill the glasses too high up. Don't overfill them, because they may spill on them or on the plate or anywhere on the table. And expect sometimes to be more of a mess around, and that is going to be possibly routine, and you just have to kind of accept that and make sure that afterwards you just clean it up, no problems. Now, as their dementia progresses, they may not be able to use the utensils anymore. They might use their fingers to start eating, and that's something that you also have to accept as a change that's going on with the dementia. As long as they're able to feed themselves, just make sure they're doing it and focus on that. One of the things we have to be careful with as well is to make sure that anything that we serve them that should be hot is not very hot, because they might burn themselves. So look out for that as well. Check the temperature of everything that you give them as well. Now, make sure that, because we are feeding, we're talking about nutrition and dehydration as well, that they're getting enough fluids throughout the day. It's very important that they make sure that they get enough fluids to not dehydrate, because a dehydrated body means a dehydrated brain, and that does not allow you to function very well, and their symptoms will worsen. Now, when you give them any type of beverages, try to limit the caffeine. They might be used to drinking a lot of caffeine, and that's fine to give them a little bit of caffeine, but caffeine is a diuretic. It's going to make you urinate more, and so you lose more fluids, so you have to watch out with what you give them. If it makes them go pee a lot more, then maybe don't give them those drinks as much. As the dementia worsens as well, the patients may have more aversion to food, forget to eat. They might have little snacks here and there in the room, pushed away, hidden, and you have to make sure that you find those foods and make sure to throw things away that are rotten. Keep foods in a certain container and remind them that this is where they have snacks, so that they can snack on those type of foods as well. That will make it easier for them. Now, be careful that they're not eating things that are not supposed to be eaten. So if that begins to happen, then you have to be even more careful as to what is in the household, so that they don't eat something that may hurt them or harm them in any way. When it gets to the point that the patient is not eating very well or forgetting to eat, then this is not a good time to be living alone. This is when you possibly have to start making arrangements to have somebody live with them, or have them live with somebody, or think of other facilities that may be appropriate for the patient. When they don't eat, then that's when we really have to concentrate even more on certain vitamins, or if one of the patients with Alzheimer's, dementia, or any dementia decides that they only want to eat one particular thing, then talk to your doctor, because you may have to supplement with vitamins to give them the nutrients that they actually do need. So that brings us to the point of what happens when they progress to the point that they're not eating, and they might need a PEG tube or a feeding tube to continue to eat. Now, that's a very hard choice to make, and we've talked about it in some of the other videos. So first of all, I think that the family has to already have that decision in place, more or less, after they talk to the patient. Hopefully they talk to him or her before they got to the point of the dementia that is too advanced. And if you did that, then that makes the choice easier. Now, some people are going to have illnesses that may be short-term. So they might have dementia, but maybe they have something that's causing them not to eat. In those instances, I think it's very useful to use a feeding tube or a PEG tube, and because they can recover from that. When it gets more difficult, I think, is when the patient has already progressed to the point that they are not eating, they cannot swallow, and And that's when the decision becomes more of a caregiver decision whether a feeding tube will be required or not. And that comes down to talking to the patient, talking to your doctor, and making the best choices possible at that point. These are just a few of the things to consider when you're preparing meals and talking about meals with a person with dementia. I'm sure there's other things that you all can discuss with your doctor, and make sure that your choices that you make are in accordance with what your doctor wants as well. For Whitecoat Medicine Talks, this is Dr. David Cruz, and I will see you next time.